The TX machine definitely gives me peace of mind.
Having that data, just before going to bed, certainly will help me sleep better at night.
It's essentially an insurance policy for the patient, and they like that.
I think that the TX does certainly give patients peace of mind.
I feel very comfortable with the dependability of the ViOptix TX.
In my practice, being able to have an objective reading gives the nurses a certain degree of comfort when contacting me, and it also gives me a certain amount of comfort when I go home and go to bed at night that we have an objective way to monitor the flap post-operatively.
Well, some of the existing methods that we've used prior to the ViOptix TX probe included implantable Dopplers, the use of an external Doppler device, and of course, clinical judgment, particularly on the part of nursing staff.
For instance, the implantable Doppler just asks the question, can you see or can't you see? The TX really describes, what are you seeing?
The TX machine has advantages over the implantable Doppler in that it is a thoroughly reliable system. Implantable Doppler can be very good, but sometimes is rather probe dependent. There have been instances where the probe has been withdrawn and that itself has disrupted anastomosis as well.
The difficulty with the implantable Dopplers is that you can have false positive readings in that you can lose your signal and not know if there's a problem with the flap or not, and that may require an operative intervention.
Well, the ViOptix kept dropping, so we took the patient back to the operating room based on the significant drop in the ViOptix trend, and we found that the single perforator was in fact kinking. So had we not taken the patient back at that time, she would have most probably ended up back in the operating room anyway in the middle of the night.
Once the TX system started to decrease in value, the resident was notified. They came and evaluated the patient, contacted me, and by that time the flap was starting to show some evidence of venous congestion. We took the patient back and we were able to successfully salvage the flap. We think that the ViOptix TX system was able to indicate that there was a problem with the flap before the clinical evidence was there.
The TX machine showed that the flap had normal circulation. So we were able to observe the patient, and we drained the hematoma locally, but we did not need to do a major operation to try to salvage the flap because the TX machine had assured us that things were okay. So that sort of saved an operation.
I've also used this on the chest or breast skin after a mastectomy to identify which portions of the skin are healthy and which portions of the skin need to be trimmed so you don't end up with a skin necrosis post-operatively. So I think we're going to find a lot of uses for this piece of equipment intraoperatively.
The ViOptix TX machine gives me a great deal of clinical confidence. And it's a confidence shared by the patient themselves because they can see the readings and they come to understand what's going on.
The patients love the system because they feel like they've gotten a little bit of ownership into their own care too. They can sit there, they can watch the monitor, they can see the numbers when they cycle, they're just ever so slightly. And if things do change a little bit, they're the first ones to call the nurses and say, hey, is this okay? Invariably, usually things are, but they really take a lot of pride in being able to kind of watch things, and it gets them engaged in their own recovery.
And for some patients, it is extremely comforting for them to have that monitor right at their bedside and for them to know that their flap is doing well.
One of the problems that we have with monitoring people of darker skin is clinically you cannot see the capillary refill in some of these patients, which makes it very difficult to evaluate a cutaneous flap. What the TX does is it removes that as a barrier because the TX will read the oxygen saturation regardless of the pigmentation in the skin.
Certainly with darker skinned patients, some of the clinical monitoring is a little harder. And so the ViOptix TX has added to our comfort level in terms of interpreting some of the clinical monitoring with darker skinned patients, absolutely.
The nursing staff has completely accepted the TX as their standard of care. When I first introduced this into my hospital, they were curious about what it was all about, and because I was utilizing this under an IRB protocol. We just let the machine run, and there was not supposed to be any reaction from any of the staff, including myself, to the machine, only that we were collecting information. Over the course of time, the nurses came to realize, and I did also obviously, that we could rely upon this information to tell us, in fact, how the flap is doing.
For some of the more junior nurses on our unit, I think for them to actually have a baseline of real-time data to kind of correlate with a flap, to them that has been particularly helpful.
The nursing unit really likes using the ViOptix TX system at this stage because it provides real-time information. We've been able to incorporate it into our nurse monitoring unit so they can see the values right on their own screens at the nursing station. So when the alarm goes off, if there is a problem, they can identify it early and go evaluate the patient. They still perform their regular hourly or every 2-hour checks, but if there's something that happens in between, they're really able to identify a problem sooner.
When the nursing staff changes between shifts, the way they interpret the sound of the Doppler might be different from different personnel or nursing staff. However, if they look at the numbers from the ViOptix TX, it is a solid number. It doesn't change. It will give you a direct interpretations without any doubt.
The TX is, in my opinion, safe. It's a non-invasive device. It sits on the surface of the flap, so it doesn't penetrate the flap or reconstruction in any way, and it's easily removable.
I think the TX system is completely safe. I don't see any problem with it. The probes come sterile. They're placed on the surface of the body. They're usually placed on at a point where you've sealed off the wounds with either steri-strips or some kind of adhesive. And it's simply an extra wire which comes up over the patient's shoulder and is plugged into a machine.
Combined with an initiative from our institution, we've been able to send patients with the ViOptix TX system directly to the floor, avoiding an ICU admission, thereby saving some of the cost of having patients in the ICU and opening up spaces for patients who need to be in the ICU.
So of course we have to be conscious in this day and age of cost. And the ViOptix TX has allowed me to transfer patients to lower level of care, to a regular floor, earlier in the postoperative period. That obviously translates to a cost savings for the hospital and ultimately the patient.
So we found that by using the ViOptix TX to bypass the ICU entirely and to have patients monitored on the non-standardized surgical floor saves our institution about $13,000 per patient during their entire length of stay.
No, we have not had any false negatives with the TX.
I've never had it show the opposite, show the flap to be good when the flap is not good.
Thus far in our experience with the ViOptix TX, we've not had any problems with false negative or false positive readings.
I think the TX system is very easy to use. It's just placing a probe, affixing it either with a couple stitches or a small dressing, and just making sure it's attached to the system right and having a good signal quality. Once those things are in line, which only takes a couple minutes, it becomes a very reliable system.
It's relatively intuitive and quite frankly very simple to use, which makes it very attractive.
It's almost foolproof in a sense that once it's attached and working properly, which is typically done by the surgeon in the operating room, it's pretty much just coming in and reading the console, and that's it.
The remote is on the TX is actually an interesting addition to the TX. What it allows you to do is it allows you to see in real time what's going on with that patient's flap.
So that when I'm at home and I'm about ready to go to bed, I can take a quick look at my PDA, see the trend, see the values.
It saves me calling the nurses and being put on hold for 5 minutes for a start. But also it's instant access to information as often as I need it, as often as I want it.
ViOptix has a dual application monitor which has eliminated some of the clutter that I have when I'm monitoring a patient from having a bilateral flap. It allows you to put all the data in one location with one set of controls, one set of plugs and cords running in every which way. It just streamlines things.
Prior to that, we would have two probes, and the nurse would simply disconnect a probe and monitor one side, change it in 30 minutes or an hour, and monitor the other side.
The service that we've received from our local ViOptix rep has been phenomenal. We're really very happy. He is just a phone call away. He has his cell phone attached to a card, which is attached to each machine.
We had ViOptix reps in the OR for pretty much the first couple weeks that we started using TIOX, and for us that was it was great because we were able to ask questions as they came up, and we had an answer right then and there. And I just found that the level of support provided by ViOptix was, I mean, it was amazing. It was bar none.
The TIOX machine makes a big difference in patients' lives. I think patients appreciate when something scientific has been used to their benefit.
I would feel very, very confident saying that it's a proven technology.
The ViOptix TIOX does allow early intervention.
The ViOptix TIOX allows you to continuously monitor a flap in a non-invasive way. You can look at trending, it's reliable, it's objective, it's just the kind of monitoring device a microsurgeon would want to have.
It would bother me if somebody decided to take my TIOX away.